Welcome back to the 980s podcast hosted by yours truly, Kevin Thompson, founder and CEO of 980 Capital Group. Thank you guys for joining me. As I always say, subscribe to the channel. As I always say, go and get my book, MLB to CFP, live on Apple and Amazon. If you have any questions, comments, or concerns, you can email us at info@9icapitalgroup.com. Send us your questions. You go to the website at www.9icapitalgroup.com. Schedule your appointment. As you know, we're here to do what? Educate, empower, and engage. And today we have a wonderful guest. Bethany McLean is back to talk about her book, The Big Fail, how the pandemic revealed what America protects and who it leaves behind. A wonderful book about what happened during the COVID-19 pandemic. And we're going to be talking about some things because you know what? I'm pissed. Let's get it. Bestseller, New York Times bestseller, Bethany McLean on the call today, talking about her book, The Big Fail. Now, guys, well, first of all, welcome to the podcast, Bethany. Again, you write such wonderful, wonderful work.
Thank you. Thank you for having me on.
So before we get into the book, you said this during our last podcast. You said, Kevin, you got to read The Big Fail because it's going to piss you off. I was like, what's going to really piss me off, right? Like I'm a pretty easygoing guy. So I pick up the book. I'm flying down. I'm flying to the West Coast for Future Proof, which is one of the Coachella of our industry. And I'm like, wow. I found myself getting pissed off on the plane and I was looking around wanting to talk to somebody, but I couldn't do it. And I immediately just go out and start emailing you. I said, we got to talk about this book. So this is what we're here today is to talk about The Big Fail, because there were so many things that have popped up, whether it be private equity, whether it be the hospital industry, whether it be our healthcare industry in itself. Oh my God. And people like myself in the Black and brown community, were the victims, as typically we always are. It seems like, oh, we're the worst hit. So let's just start there. The failures and the pandemic preparedness. I'm going to start here with this, and we can go into this. I am with the previous administration. I'm starting to think like, man, I really like President Bush. I'm a big fan of his all of a sudden because he had a preparedness for the pandemic already set in place. Obama came on top of it, took it as well. And then the Trump administration came in, and we're not bashing anybody here, but you can if you want, it's on you, but I'm just telling you, he came in, ripped it apart, and he blamed it on Alex Azar as a scapegoat. So talk to me a little bit about what your findings were about the failure and that's a hard word to say, pandemic preparedness and what went wrong with all of that.
So I have a little bit of a nuanced issue on take on this, in the sense that, yes, President Bush started to worry about pandemics, and he was the first to really begin to say this might be an issue for us. Yeah. He read John Barry's wonderful book and said, we are not prepared for a pandemic. Yeah. But everybody thought, and inherent in the pandemic preparedness plan,
yeah, it's hard to say.
that alliteration is really tricky. From both Bush and Obama was the idea that it would be an influenza-like virus, and COVID was not influenza. So one of my takeaways is it actually is kind of hard to have a plan, because you can't just march through something assuming that this virus is like the virus you thought it was going to be. And that, I think, would have some of the things we did that assumed that COVID was like influenza were, I think, quite dangerous and destructive. So, for example, shutting down schools. It did make a lot of sense in the initial wave to shut down schools because we didn't know. We didn't know what this was, how it was spreading, who it was going to impact. But keeping schools shut was a spillover from influenza, where kids are the transmitters. They're not. And COVID. And we did a lot of damage to particularly disadvantaged communities. And a lot of that was because of the assumption that COVID was somehow something like influenza. So yes, you need to have a plan and you need to have something in place, but you can't assume that A is like B or that history is repeating itself. That said, to me, what went wrong so more in the Trump administration was not so much the lack of a plan. It's that it was an administration where people didn't trust each other and where everybody was out for themselves. themselves and out for their own standing in the media. And when you think about one big contrast between the Trump years and the Biden years is the number of leaks coming from within the Trump administration
Yeah.
versus the paucity of leaks from the Biden administration.
Yeah.
And you can see then on full display what a viper's nest the Trump administration was. And that really turned out to matter in the pandemic because it wasn't everybody pulling together as a team to figure out what we're going to do. It was everyone out for themselves in these antagonistic factions. And that made it far more difficult to pull together and take this seriously and do the right thing than it would have in a cohesive administration.
Well, I'm agreeing with you because you sound so eloquent when you say it, and it's great when you say it. But my question is, it's not like President Bush didn't have SARS or all these other things that came along the pike, where it was just he had a playbook in place where he's like, okay, this is what we need to do, this is what we need to do. But then when you get to a certain individual, and again, I'm not pro or con, but a person that basically says, no, we're gonna do it our own way, and we're gonna basically push this down. We're gonna tear this apart because we don't need all of this stuff. Let's make it very thin. And then now it hits, and it's like, oh my God, what are we gonna do? Right? Like
Yeah.
we're just trying to figure this out. I mean, I think you mentioned in the book where even even one of the guys in the administration was trying to barter deals for PPE. I mean, it's like, come on, man. So it just gets
Right.
really, really convoluted with that.
Yeah, I totally agree with that. And I do think that if there's a big lesson coming out of, well, there are many big lessons coming out of the
Yeah.
pandemic, hence the book. But
Mm.
one is that you do need these plans need to be really, really multi-layered
Yeah.
because everything from how you're going to get PPE for people, who's going to be in charge of that, how you're going to navigate between states' rights and the federal government, and who gets to make those decisions, down to how you're going to bring people back in from who are stranded outside the US.
Yeah.
There are just so many nuanced questions and issues around this.
Yeah, and we could all agree that it was botched a little bit, but again, it was one of those things where it happened everywhere. Everybody shut down, so it wasn't just the United
Yeah.
States. It was all around the world. So it was no one's fault. No one saw it coming, and it was just one of those unfortunate circumstances that we are all living with today in regards to supply chains and things like that. Now, that's another thing, and they're not going to get into it, but supply chains, inflation, all the other things, that's a whole nother podcast. But one thing that you mentioned to me or mentioned in the book was the healthcare industry and the system of inequality. I mean, like I've always said, it's always the Black and brown communities, whether it be the community hospitals, whether it be the more well-off hospitals. Talk to me a little bit about around just the divide between the well-sourced hospitals versus the community hospitals that weren't as resourced, and why is that? I mean, why is there such a huge difference between the two?
Right. Well, that is one of the horrible things about the pandemic is that we saw that it disproportionately affected people who had not had access to healthcare before the pandemic.
Mm-hmm.
It preyed on all of our pre-existing weaknesses, both as a society and in terms of people's health.
Mm-hmm.
But the underlying reason for why we have such an unequal healthcare system is that we treat healthcare like a business.
Yeah.
And but yet the system is incentives that are in place is not the way. If you were to treat it as a business, then you would want to have a system that incentivized better care at a lower cost. But we don't. We treat it as a business, but we have this incredibly gameable set of rules in place that enable hospitals to make money by basically gaming the system and figuring out ways to maximize reimbursement, not by delivering better healthcare at a lower cost. And our system rewards the hospitals that play the game really well, and it disproportionately punishes those that don't play the game. And the ones that don't play the game are, of course, hospitals in less well-off areas.
Yeah.
And then people say, oh, this hospital isn't making money, it needs to close because it isn't making money. Well, wait, you established the preconditions by which the hospital could make money, and you made it impossible for this hospital to make money. And now you're justifying closing it and removing beds from an area where they might be needed because you established the preconditions that made it this way.
Mm-hmm.
And so one of the numbers that really stood out to me, and I might mangle this a little bit because it was a while ago, but when the pandemic hit, the less wealthy areas of New York, like Queens, had like 1 bed or 1.5 beds per thousand residents, whereas wealthy Manhattan had 6 beds per thousand residents, precisely because of this system of incentives we've put in place. That's not looking at hospitals like a part of our healthcare as national infrastructure and saying, where do we need beds in order to take care of people? That's a direct result of treating it like a business, but with these really flawed incentives in place. And then lo and behold, a pandemic comes and you don't have beds in the places where you need them. And
Mm.
so one of the things that really stood out to me when we were working on this book was that all of the stories of hospitals just with patients being with morgues outside
Yeah.
and terrible overwhelmed hospitals, they were all in poorer areas. And
Yeah.
that's directly because of this under resourcing of these hospitals. And then to compound that, there are no incentives in place that reward the system coming together as a system in a time of crisis and saying, okay, if this hospital here is being overwhelmed with patients, they should be transferred to this wealthy hospital here that has the money to take care of them. There
Mm.
was none of that.
Mm.
And so the only hospitals that did it, like Rush in Chicago, did it on their own,
Mm.
because they thought it was the right thing to do. And
Yeah.
and so that's so we have this twofold problem. We don't have a hospital system. We have this complete chaotic mess that can't come together when there's a problem. And then we have a system that treats hospitals like a business, but without the incentives in place that even then, arguably, I'm not sure healthcare should be a business where the bottom line is the only thing that matters. But at least if you're going to treat it that way, have it be the incentive to provide better care at a lower cost. And that's not what our system rewards.
Well, you got Milton Friedman, right? This is Uncle Milton Friedman, or you want Adam Smith? Which one do you want? A lot of us say, freehand capitalism, Adam Smith, or do we want the Milton Friedman where we're saying shareholder wealth is the most important thing and the only thing that matters? And what you're
Right.
left with is what you just discussed.
Yes. Yes. But when it comes to hospitals, it is, I think, important to point out that it is particularly perverted. And one of the numbers that stood out to me. So HCA Health is the best performing hospital chain in the country. Out of the top 10 most expensive hospitals, 7 of them are HCA hospitals because they figured out how to play the game. They're not so profitable because they're delivering better care at a lower cost. They're profitable because they figured out how to game the system. And that's then a really perverted form of capitalism. I mean, even if you think that Milton Friedman's precepts should apply in healthcare, then make sure that the profits you're incentivizing are the profits you want and
Yeah.
not profits that come from gaming the system.
Yeah. Well, why can't we get higher reimbursements from the United States government? I mean, that's what everybody's been doing and been gaming the system for far too long. You mentioned the cost plus system when back in
Yeah.
1965 ish or whatever. And then people are incentivized to say, you know what? How much can they reimburse us? Let's get them
Yes.
up to the maximum amount. That's where our margins are going to be the best. And
Right.
it's
And
just, it just kills me. Go ahead. Go ahead.
and the great irony of that is that it's people who say they believe in the free market who are actually playing that game, and every bit of money they're making comes from gaming the government. But then they cite the free market as the reason for their success, and
Oh,
that
and now they're angry because the government's saying, let's reevaluate this for a second. We're going to give you guys lower reimbursements. And then now you're saying, oh, well, I can't work with these people. Medicare, Medicaid patients, we're not going to take them anymore. Where is the line here in regards to like profits over people? Like, where is the line? Like, what do you think the line actually is?
Well, I think a lot of people don't think about it because we've become such an individualistic society that there is in a lot of people this instinctive belief that if you can't pay for healthcare, well, maybe you don't deserve healthcare.
Wow.
Even if you were to take that as a given and say, we're not in this together, what the pandemic showed is that we are in this together. Lyndon Johnson said when he passed Medicare and Medicaid, without the health of our people, we can't do anything as a
Mhm.
country. And to me, what the pandemic pointed out that no matter how individualistic you might be, if people around you are dying, that's going to shut down society. That's going to impact you. So even on this purely selfish level, if you were to embrace it, you would have to say after the pandemic, wait, we need to have a healthy country. We need to figure this out because it's in everybody's best interest to figure this out. We can't have this individualistic attitude toward health.
I agree with you, but you all know it's capitalism on the way up. socialism on the way down, and the same thing just happened. We threw a bunch of money at the problem. We saved a bunch of businesses because no one was crying when they got that PPP money. No one was crying when they got federal money, taxpayer money, and then now they're laying these individuals off 3 years later. That's a whole nother book and a whole nother saga right
I
there.
know, I know. And I think what we don't like to talk about, everybody likes to laud the US response for throwing money at the problem. And it is true. In some ways, our economy looks to have come out of the pandemic in better shape than places that didn't throw the same amount of money at it. But what people don't like to talk about it is that the federal debt is a real thing.
Yeah.
And it will matter at some point. It hasn't mattered for a lot of years, but it will matter at some point. And the fact that we're so heavily indebted as a country as a result of what we did, there was a cost to it. And I hate that we don't like to talk about that.
I've read I don't want to mention her name, but modern monetary theory. Her book was great. I just think that it's just one of those things where it's like, well, everything's going to work. We can keep borrowing as long as GDP is above what our borrowing cost is, and then we should be good. Well,
Right.
then inflation hits, then you got to raise interest rates, and now your borrowing costs go up, and it's just
Right.
it just works when it doesn't work at the same time.
Right. I mean, it would be a really lovely thing if there were such a thing as free money, but it just flies in the face of it defies reality to believe that.
Yeah. So a couple more things real quick, because we mentioned private equity, and one thing people talk about right now, they see Red Lobster. What happened to Red Lobster? Was it the free shrimp they were giving out and all that stuff? And then you look at the inner workings of it. It was private equity loaning back their real estate, basically over leveraging the real estate, and then basically lending it back to them, making them pay for the real estate, and then basically making them go belly up, based on the fact that they just basically took that leveraged money and kept it for themselves and just destroyed the company. And that's the same thing that's been happening in the nursing homes
Yeah.
within the United States. Go ahead.
Well, it's a huge change in private equity. So back in the 80s, private equity used to be called leveraged buyouts. And no one's been able to answer this for me, but somehow private equity figured out how to rebrand into the much friendlier sounding private equity. Because if it were still leveraged buyouts, people would be like, wait, I don't want that leveraged buyout. But when it comes private equity, that sounds
good. It sounds sexy all the time. It's sexy.
Right. Or like it's building something. And so, but in the best of worlds, private equity did actually build something. They invested in a company. If they were able to make the company better and more profitable, then everybody won. If they weren't able to make the company better and more profitable, then everybody lost. But what happened during this period of ultra low interest rates is that private equity figured out how to use financial engineering just to be purely extractive. And what that means is that they can win even if everybody else loses. And they can win, per your Red Lobster example, by selling the real estate, taking the money from selling the real estate, paying themselves a huge dividend. They've won. They've gotten their money out. It doesn't matter what happens to the company after that. And they did the same thing with many hospitals. One of the biggest buyers of hospital real estate has been this company called Medical Properties Trust. And it was essentially used as a dumping ground by private equity firms that had come in and bought hospitals and realized the hospital business was much tougher than they thought. And instead of accepting that they'd made a mistake and losing money, they sold the hospital land to Medical Properties Trust, paid themselves big dividends, made profits, got out, but left these heavily indebted hospital chains behind them. And so in my view, private equity in many respects has become an extractive industry. It just it extracts whatever it can, and then it leaves behind the shell of a company. And there's something wrong with that. I don't have anything against everybody winning or everybody losing together. I mean, I have something against everybody losing, but whatever. At least that's in some sense a more fair version of it. I think something has gone badly wrong where private equity can win in the sense of making money and everybody else loses. There's something wrong with that.
It's absolutely something wrong with it, because you go to those nursing homes and next thing you're saying, okay, we got to make this more profitable. We're going to cut staff, but we're cutting staff and cutting just materials and labor and all the stuff to the actual nursing home. It leaves it worse off. How's it supposed to win? You know, You're trying to protect your margins. I get all of that. People say people are our highest cost in regards to doing business. Well, yeah, but at the end of the day, you need people to run the operations to make it continue to go. You can't just have a bunch of, I guess, robots in there. I guess you could, but I don't know how that's going to work. But
But one other important point on this, that I actually think this is for an economy to work well, government and business have to function well together. And I think what's happened with private equity's involvement, particularly in healthcare and in nursing homes, is more the fault of government than it is of private equity.
Absolutely.
Because in the end, if you let private equity invest in a business and you don't set rules around what's going to happen, private equity's responsibility is to their investors. They have a fiduciary duty. So what they're going to do is try to make money in any way possible. So guess what? If you government don't want them to do that, then don't let them in the door, or figure out a way to put strictures on what they can do if they're going to come in the door. But you can't just allow a private equity firm to say, buy a nursing home, and then shut your eyes and watch as the private equity firm does whatever it can in order to make money, because that's how it works. That's what's going to happen. So this to me comes down to the failure of government to set the right rules for how business should function.
Well, that's anti-capitalist. That's not the free markets that we desire. We don't want that. We don't want governments in that. Let the market tell us where it's gonna go.
But we don't have, and I know you're playing devil's advocate, but look, there is no such thing as the pure free market without
1000%.
rules set in place by the government. So think about the existence of a limited liability corporation that allows people to function without having to worry about having personal liability for the business. That's a gift of the government.
Yeah.
Think about bankruptcy court, without which U.S. markets would completely shut down. Everybody relies on bankruptcy court to set the rules of what happens if it doesn't work out. Guess what? Bankruptcy courts are the government. That's the government setting the rule for how this is going to function. So the idea that there is a pure, wild, free market without government setting the preconditions, it's not true. It's just not true.
It's not true. You're absolutely right. And another thing that came out of the pandemic was how globalization has impacted the overall environment, the just-in-time inventory, and how it just exposed all the things that have been going on there. Talk to me a little bit about what your thoughts are in regards to the supply chains, how they were impacted, and how globalization was basically a consequence of what occurred.
So I think what we saw in the run-up to the pandemic was, if you could make it cheaper someplace else, then of course you did. And supply chains were squeezed to an absolute breaking point by this idea that if you can get something from someplace else more cheaply, then you should. But what nobody took into account was the concept of resilience. What happened if suddenly China wanted to keep all the masks that were being made for itself? What happened if suddenly ports got backlogged because of workers unable to do their jobs? And I think we need to think about resilience as part of a supply chain. If it's squeezed to its absolute limit, to its absolute breaking point, and something comes along that breaks it, guess what? Global supply chains are actually this really fragile thing. And maybe you as a business should take something else into account. Maybe you should pay for some form of resilience. And the same, by the way, is true of people. Because if you push your workforce to the absolute breaking point, taking every ounce of everything they have, when something snaps, when something breaks, they snap too. So maybe you should be trying to build resilience into your workforce too, such that they have some flexibility, some sense that they're taken care of, some sense that it's not just being pushed to the max. And that's, if you view capitalism through a long-term lens, that's a more successful business in the end, is one that doesn't break when something unexpected happens. And I think it's a function of our very short-term oriented capitalism, that it's all about next quarter's profits. It's not about, are you going to be around in a decade? And I think we've needed for a long time to shift our thinking to, are you going to be around in a decade, not next quarter's profits.
I guess my question now for that, because it brought up a point, like, are we no longer in a 100% free market capitalist structure? Because every 8 years, I said this to one of my buddies a couple of days ago, I said, something's got to give. Every 8 years, we're throwing money at a problem. Like, when is this going to stop? When are we going to let something, whether it be the early 2000s, whether it be 2008, whether it be 2000, I mean, on and on and on. It's just like, it's getting to the point where it's like, is there something where we're going to say, okay, let's just allow the system to function and see where we go from there? Because if we keep throwing money at the problem, it's going to be an 8-year, 10-year thing where we're doing the exact same thing over and over and over again.
Well, I agree with you. And the frightening thing is what happens if doing the exact same thing no longer works.
Mm.
I don't think we were ever in this pure capitalist environment. I think we pretend that we are, and people
100%.
who've been successful in it are particularly prone to thinking that they did it because they're great and that it's the free market without ever looking at how the system actually benefited them.
Yeah.
But clearly, long-term capital management in the late 1990s, the financial crisis, where the most capitalist institutions supposedly in the world had to be bailed out by taxpayers, and then onward to the pandemic, where the Federal Reserve had to then do things that had not way more than it did in the financial crisis in order to save the system. And so the question becomes to me, what is a world where the Fed, the central bank, is so central to our economy? How does that look? Is that really the world we want? And what happens if a problem comes along that is too big for the Fed to address? I mean, you see now how much the market moves in response to whatever the Fed does. And that's an unhealthy dependence on central bank economies. And I think it's a sign of an economy that has become detached from the real world of what companies do, how much they make, how an individual company functions, to broad view of what the central bank does is what matters. And I think that's it's a very different world, and I think it's problematic. I'm old school enough to think that it's problematic. I'm not sure how we get out of it.
I'm not sure how we get out of it either. I just think right now, once you've given the patient the I guess the morphine, I mean, you have to keep giving them morphine. Maybe you can kind of pull it back a little bit, but
Right.
ultimately they're gonna need that in the future. Thank you for this wonderful expose. A couple more questions really quickly. Like, so the healthcare system, the way it's set up right now, are we doomed to just be in the situation where for profit motives, more hospitals get consolidated to where it's just more stock based? Or are we going to realize eventually that, you know what, let's get the for profit narrative out of the system of healthcare where it's not profit over people, it's actually people over profits?
I mean, I don't know. I
Mm,
think everybody realizes that our system is fundamentally flawed, and all you need to do is look at the amount the US spends on healthcare, which as a
yeah.
percentage of GDP is double any other wealthy nations, and then look at our outcomes, which are
Yeah.
worse, and say, wait. Even if you believe in a totally for-profit system, what we're paying for isn't delivering the
Gotcha.
results that we want. Why is something is going badly wrong here? And
Yeah.
I think people do understand that, but the system of incentives that's in place is so powerful that I would have thought the pandemic would have been this moment where everybody would have said, we need to do something different. We need to rip this thing out and start from scratch. And we're not. We're just continuing to do more of the same. So at this point, I don't know what changes it. I don't know what changes it.
Well, I hope it's not more of the same where we have another one come on, more money go to the system, more private equity make a ton of money, more people making money on people's deaths. It's just, it's when you said in the book, when it was talking about how they were afraid to move money, to move people or to transfer people to other hospitals because it was not in the incentive for the hospital to do so. I'm shocked.
All right.
When you hear a hospital say that and you read it, you're like, they can't be saying that. I mean, you
No.
can't really. It's not real. This is not real.
No, but it was because if a hospital took in a patient without insurance in COVID, and that patient was sick and needed to be terribly sick and needed to be on a respirator, that isn't a quick treatment. Let them out the door. That patient is going to be in there costing them money, unreimbursed money for a long period of time, and that's not in any hospital that cares about its bottom line. That's not in their that's not their
Yes.
incentive.
Yeah.
So in order to do that, they have to say we are going to do what Rush did and say we are going to accept that we're going to lose a lot of money because it's the right thing to do. But that then again goes to the question of government, which is what do you do? Do you figure out a different system to incentivize healthcare institutions to take care of people?
So last thing, like how much? Because you mentioned this in the book, and I can't remember. Was it $6 billion that Rush lost in that quarter alone, or whatever that was?
I think it was more like a billion, but
Yeah.
they lost a lot of money by doing this.
But who cares? At the end of the day, I know, but the mortality rates were far superior than the community hospitals because they had the equipment to take care of people.
Yes. And they told me one of the most heart-wrenching stories in the book was saying when they would be on the phone with other hospitals trying to transfer their patients, and the person who was arranging the transfer would turn and yell, Russia's taking them, meaning this person's got a chance now. They might actually live. And you see in that small example just how profound this can be, people doing the right thing, even in the face of a system that didn't incentivize them to do so. And maybe we all have learned that. Maybe we all have learned that. I think the younger generation is different.
This is a stupid question. Last question, by the way, but I don't want to make a stupid question. But why aren't the community hospitals funded the way they need to be funded? I I don't understand. I mean, we have money going everywhere. We're paying $800 billion for our military, to Lockheed and to all these companies. But you're telling me we can't put money into our healthcare system to where our community hospitals have staff, have equipment?
Yeah. Yeah, I think it's this perversion of the idea of profits that well, they don't make money, so therefore because they don't make money, we need less of them rather than more of them, even though, as we talked about at the start of this podcast, the fact that they don't make money has been structured by the government to be that way. And I think if you really do believe that people's health, if you really do believe what Lyndon Johnson said, that without the health of our country we can't do anything, then you have to restructure this entire system, because it is not only devastating financially, the fact that we're pouring this much money, that we spend this much on healthcare, but that it doesn't work, and that in places where people really need healthcare, they can't get it, despite all the money we spend. That something is going badly wrong here.
Well, I appreciate the book. Phenomenal read. Thank you so much for your insight. It was a wonderful just explanation of what went on during the pandemic. It did piss me off, but again, I'm okay now. I'll let you know. I got a little upset, but I'm okay now.
Well, I'm glad at least that I was right and that it did piss you off, because I like to be right. So
I know. Well, thank you for joining the 9 podcast. Any last words you have for the community?
I think that we all want to forget about the pandemic. We want to pretend that it didn't happen. I think it was such an unpleasant couple of years, and it's so odd how it feels like the distant past.
Yeah.
But it's not the distant past, because a lot of the things that happened in the pandemic really shone a broader light on problems in America that are worth understanding. And so I think it's important not to just skip over this period in our nation's history and pretend that it didn't happen, because it's no fun to look at it. So
yeah, you're absolutely right. But again, I love you, support you. Great books. Let me know when the next one's coming out, because I don't want to stay pissed. So maybe bring a little bit of happiness to me at one point in time. But again, thank you for joining the 9 podcast.
Thank you very much. Thanks for having me. Bye.
We had Bethany McLean on the 9 podcast. We're talking her book, The Big Fail, What the Pandemic Revealed About America and Who It Protects. As you know, Black and brown communities were hurt the worst during the pandemic because the community hospitals in those areas were underfunded and under-resourced, and they had higher mortality rates versus the larger, more well-funded, well-resourced hospitals in those areas had lower mortality rates because they had the equipment and the staff to handle that. So it's not fiction, it's straight facts over feelings. That's what we do here. And unfortunately, it was a bad time. And again, don't forget what happened, because we're doomed to repeat it if we do. We cannot have profits over people. Thank you guys for joining the 9 podcast. Subscribe to the channel. Go and get my book, Get My Beat to CFP Live on Apple and Amazon. If you have any questions, comments, or concerns, you can email us at info@9icapitalgroup.com. Send us your questions. Go to the website at www.9icapitalgroup.com. Schedule an appointment. As you know, we're here to do what? Educate, empower, and engage. And today we talked about the big fail, how the system was broken, how globalization became an issue, and how where you were and what you had and who you were, and if you had insurance, determined if you lived or died. It's a sad, sad day. And I hope we can all look back and think about this 50, 60 years from now, if I'm still alive, and wonder why. Stay humble, stay safe, my friends. I'll see you again soon.